Obesity is a complex chronic disease with several causes that lead to excessive body fat and sometimes poor health. When your body has too much extra fat, it can change the way it functions. These changes are progressive, can worsen over time, and they can lead to adverse health effects. Obesity in childhood is associated with a wide range of serious health complications and an increased risk of premature onset of related illnesses. Studies have found that without intervention, children and adolescents with obesity will likely continue to be obese into adulthood. In 2021, the Caribbean Public Health Agency CARPHA reported that the Caribbean had some of the highest rates of obesity in the Americas, with an alarming increase in prevalence levels in children aged 5 to 9. Meanwhile, the World Health Organization (WHO) found that Trinidad and Tobago ranks 8th worldwide with an obesity rate of 14% in those less than 5 years old. The Pediatric Society of Trinidad and Tobago in 2023 said their members had been noting with growing alarm the increased numbers of overweight and obese children presenting to hospitals and private clinics, and revealed there has also been a significant increase in childhood type 2 diabetes and other comorbidities traditionally associated with the adult population. Many of the causes of obesity are preventable and reversible, although other factors such as hormones and some medications are involved. The fundamental cause of obesity is an imbalance of calories consumed and calories expended. It must be noted that there has been an increase in the consumption of energy-dense foods which are high in fat and free sugars. Trinidad and Tobago's Minister of Health at a Health and Wellness Expo in February 2024 called out fast food mega chains and beverage companies, saying they had to take some blame for the health condition of some sectors of society. The health minister's advice: cut down on fatty foods and sugars and get moving.
If you want to live a healthier life, especially for the diabetic, the hypertensive, the people who have a little extra weight, and for children, parents, your children, just do things in some moderation. So we're not saying don't drink Coke and Pepsi. What we are saying, if you're drinking 3 and 4 and 5 Coke, Pepsi, Chubby, Solo a day, reduce that and substitute some water. We are not saying don't eat KFC. We're not saying don't eat this, don't eat that. What we are saying is cut out one of these per day or 2 or 3 per week and substitute it with some healthier food options.
The Ministry of Health's TT Moves campaign encourages citizens to make the changes required to achieve a lifestyle of regular physical activity and healthier diets. I'm Karen Kozier-Phillip with your TTT News Health Check.